Hello, I'm Dr. Marla Shapiro. I'm the past president of the Menopause Society, and today I'm talking with Dr. Sheyl Green about something really important, CBT, cognitive behavioral therapy, and how we can use it to manage menopause, which is a topic I'm completely interested in. Let me tell you who Dr. Green is. She's an associate professor and co-director of clinical training in the Department of Psychiatry and Behavioral Neurosciences at McMaster University, clinical and health psychologist, Women's Health Concerns Clinic, and Firestone Sleep Medicine Clinic in St. Joseph's Healthcare in Hamilton, Ontario, Canada, a fellow Canadian along with me. So welcome.
Thank you
So
so much.
let's first talk about CBT, because we all know those letters, but I don't know that we all know what it really is and what it can do. So can you give us a primer?
Oh, I'll be glad to. So, cognitive behavioral therapy, or CBT for short, is an evidence-based psychological and behavioral treatment that has over 4 decades worth of research support. It involves talk therapy, it's delivered by a trained mental health care practitioner, and it really helps people identify inaccurate thoughts or beliefs, negative ways of thinking about a situation or a symptom, and provides skills and tools and strategies to replace those inaccurate beliefs with more accurate and balanced ways of thinking. It also involves behavioral strategies that are taught and practiced in a way so that people can learn to respond to situations and their symptoms in a more helpful way.
Okay. So if we think about menopause and we think about hot flashes and night sweats, we're a really bothersome physical symptom. Walk me through how CBT, and we know it's evidence-based, how does it work in terms of addressing these symptoms?
Yeah. So importantly, as you mentioned, vasomotor symptoms, the hallmark symptom of menopause here experienced by 80% or more of women going through the transition, is one of the 5 common symptoms in addition to anxiety, depression, sleep difficulties like insomnia, and sexual concerns. And fortunately, we do have very effective treatments, medications that target these symptoms, including hormone therapy and SSRIs, also known as antidepressants. But there are not every woman who is able to take these medications. It's contraindicated for some, and there's intolerable side effects for others. So having a non-pharmacological treatment option is also critical for those who cannot take
Right.
medication or prefer or choose not to take medication, which is often the case with folks. So being able to target a physical symptom such as vasomotor symptoms with something that's a psychological behavioral treatment is not necessarily so intuitive at first glance. But what we're trying to do is not necessarily take that physical symptom away completely. So that's not realistic. We take kind of the same approach as we would with chronic pain, where if we're using CBT to treat chronic pain, we are not trying to get rid of the pain completely. That's not realistic. It's chronic. We're trying to target different aspects of the pain experience. And in this case, same thing with vasomotor experience. We're targeting the severity, the distress of the hot flash. We're targeting how much it interferes with a woman's life and how long it hangs around for, and even how frequent they come about. So we're using tools and skills and strategies that are psychological and behavioral based to target those aspects of the experience.
So accessing CBT in terms of training and getting therapists is not the easiest thing to do. Does the CBT teach you to acknowledge the symptoms and channel your response in a different way? What is it that we're trying to do here?
Yeah, it's wonderful that we have just a truckload of practitioners out there who are well versed in
Mhm.
CBT. Everyone from psychologists, psychiatrists, social workers, psychotherapists, they are well versed in CBT. And but that being said, the likelihood of someone who is well versed in CBT also being well versed in menopause is very low at this time.
Right.
We are changing this in our profession, so rest assured. But I do also want to provide some reassurance that if a woman who is experiencing menopausal symptoms seeks out a practitioner who is trained, well versed with CBT, that individual, and they're not well versed with menopause, that practitioner follows what's called the biopsychosocial model of understanding their patient's difficulties,
Right.
understanding their patients presenting symptoms and problems. And what they'll do is they'll listen, they'll learn from their patient, and they'll tailor the evidence-based strategies to meet the unique needs of each patient that they serve.
So if I've seen a practitioner, or we are a practitioner who's given a patient menopausal hormone therapy, and we want to add on, can we do the two together?
Oh, that's a wonderful combination that I see very frequently. Oftentimes, our effective medications like hormone therapy, you mentioned, SSRIs, are helping relieve the symptoms that a patient is experiencing, a woman's experiencing, but it's still not to the point where they're experiencing the type of relief they want and need.
Right.
It's still distressing, still interfering. So CBT as a complementary form of treatment is an excellent idea to suggest to patients that we work with. It will still have the benefits of the medication, but also giving now our patients skills and tools and strategies to manage those symptoms more effectively. And as a non-prescriber, I find that too very empowering for women to learn how to give them tools and strategies to work with their symptoms so that it is reducing the distress and interference in their lives.
So are there some basic CBT skills that practitioners, such as myself, primary care, OB/GYN, who are seeing these women can institute in our own practice without necessarily being experts, if you will, in the provision of CBT care?
Yeah, and I think especially coming from a variety of our like multidisciplinary team members in working with women with symptoms during menopausal transition, it is really important to kind of understand that how we respond. I mean, having symptoms is one thing, we can't get out of it, but how we respond to those symptoms
Mhm.
or appraisals of them can really make our experience or somewhat tolerable, and others just catastrophize and make it so much more burdensome. So I think addressing that our thoughts, how we work with our symptoms, that we are capable of implementing different strategies, like the way we think about it. Having for instance, if someone that you're working with, they're describing, oh, being in the middle of work meetings, thinking, oh gosh, I have all these hot flashes, I'm gonna have another one. Oh, there is one coming on right now. It's time for me to contribute, I'm going to look like a mess. I'm going to be
Mm.
incompetent. Everyone's going to notice, think something's wrong with me. Now that's like contributing not only to the distress experience, but it's not accurate either. Not everyone is looking at you, and even if they are, they're not necessarily thinking that there's something wrong with you. And that particular type of situation can lead to a problematic behavior, such as leaving the meeting and be very
Right.
interfering. So we can really encourage people to um, uh, manage those symptoms with some of these, the way that we think about
Or challenge those beliefs.
our beliefs. Yeah,
Yeah.
targeting the beliefs and then engaging in behaviors that are more helpful as opposed to interfering.
So where do we as practitioners find either a psychologist or a psychotherapist who specializes in CBT? And in the age of telemedicine,
Mm.
the fact that we are now being able to deliver some of these skill sets online, has that changed the availability?
Oh, absolutely. And certainly in my practice, I'm able to reach more people and especially in rural areas, which is wonderful. I think that if someone is interested in pursuing CBT, I mean, first and foremost, maybe bring it up to family doctor or gynecologist, and they might have some potential referrals. But people can also, there's national associations that exist.
Right.
The Association for Behavior and Cognitive Therapies, for instance, and in our country, in Canada, Canadian Association for Cognitive Behavioral Therapy. There's going on the website and having a look at who's therapists who specialize in CBT. There's lists there. Um, there's also I want to offer too, like there's nothing stopping us from going online and having a look at CBT self-help books that exist and getting a little bit more of a sense of what is this approach all about. So there's general CBT, but there's also CBT that are books that are menopause specific. So there's all sorts of resources here now available and continue to grow.
Well, thank you so much for joining us today and giving us in primary care and OB/GYN some of the strategies or where we can look and become a little bit more self-aware and self-educated. Thank you so much for joining us today.